you a bunch of questions today about your health and your health history. How are you doing today?
Good.
Just so you know, this interview is going to take about 15 minutes. I'm going to ask you a bunch of questions just so I can get a complete history of you and your health and the history of your family, just so I can get an idea of what's going on. Okay?
That
All
sounds
right.
good.
I just want to let you know that anything you share with me today will be kept completely confidential. It'll only be shared between myself and your healthcare team. Is that okay with you?
Sounds great.
Perfect. So can I just get you to confirm your name and your birth date, please?
Brian Harrison, January 12th, 1974.
Okay. So that would make you 42.
Correct.
Okay. What's your address?
1600 Pennsylvania Avenue, Washington, D.C.
So you were from the U.S.?
Yes, I am.
That's where you were born?
Yes, ma'am.
Ah, our neighbors to the south. Are you married, Brian?
I am.
How long have you guys been together?
14 years.
What about your background? Where are your parents from? Your grandparents?
Italy. We're from Italy. My grandmother still cooks for me for every lunch.
I know what you're talking about. Grandmother's cooking, always the best cooking.
Absolutely.
What do you do for a living?
I'm an architect. I've always wanted to do it. Now I have a chance.
Sweet. So what brings you to the clinic today?
I have a cut on my foot, and it's not getting better. It's been about a month.
Oh yeah? Has it been sore as well?
Yeah, it's sore when I'm walking.
Yeah.
It really sore when I'm walking. It aches a little bit when I'm sitting down.
Where is it located?
It's at the top of my right toe there, just behind it,
Yep.
and it's about an inch long.
And what were you doing when you cut your foot?
Barbecuing, steak knife slipped off and hit me right in the toe.
Yeah. You said it was sore. Is it just around the cut or is it just the whole foot?
Local, just around the cord.
Just around the
Just
cut.
around
Okay.
the cord.
Can you describe the pain for me? Is it burning, sharp, dull, aching, gnawing, throbbing pain?
It's a burning pain when I'm moving and walking around. It's a dull, aching pain when I'm sitting and resting. Sometimes there's some tingling in my toes, but that actually I think has been happening before.
Oh, yeah. On a scale of 1 to 10, can you tell me how bad the pain is, with 1 being not very bad and 10 being a little bit worse, when you're walking versus when you're sitting down?
It's about a 5 when I'm walking.
Yeah.
Sitting's about a 2.
Okay. How long ago did you cut your foot?
It's been about a month now.
When did you first notice that the soreness wasn't going away or that the cut wasn't healing?
I went for a walk with my wife a couple days ago.
Um, how often do you feel the pain? And when do you notice it the most, and how long does the pain usually last?
I usually feel burning pain when I'm walking. The achiness comes when I stop walking, comes and goes. It usually lasts about 30 minutes or so.
How long, do your cuts normally take a long time to heal?
Um, Lately, a little
Lately?
bit.
Yeah.
Yeah, a little bit lately.
Is there anything that makes your pain better or worse?
It hurts mostly when I'm walking, like I said. I'll just pop a Tylenol or an Advil if the pain starts to get bad, you know?
I think your cut hurts a little bit more when you're walking, just purely because of where the cut is. It's your shoe is sitting right on top of it. It's
Yeah.
probably rubbing right
Yeah,
against
for
it.
sure.
So why do you think your cut isn't healing properly?
I guess I walk a lot.
Yeah,
That's how I get around.
that's how you get
So.
around. Okay, so now I'm just gonna ask you some questions about your health, your past health.
Okay.
As a child, did you have any illnesses such as measles, mumps, rubella, or chickenpox?
Chicken pox when I was 4.
Yeah. Have you had any accidents or traumatic injuries, car accidents, broken bones, penetrating wounds?
No,
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 nothing.
not a one.
Have you ever been diagnosed with a chronic illness such as diabetes, hypertension, heart disease, or cancer?
I was told I was pre-diabetic in my 30s, but I think I got over that.
And the doctor told you to control that with diet and exercise. Did you
That was
give
the
you
idea,
no
yeah.
medications? Okay.
Yeah, I didn't actually do
Yeah.
that, but...
Have you ever been admitted to the hospital for anything? Any operations?
Yeah, I had my appendix taken out when I was 20.
So you had appendicitis.
I did.
Can you tell me the name of the surgeon in the hospital you were at?
Yeah, it was Dr.
Yeah.
Cutler at Chicago Hope.
Yeah. And you recovered quite nicely,
Yeah, no
as per
problems.
usual, no complications.
Yeah, not a one.
All right, that's good.
Not a one.
What about your immunizations? Are they all up to date?
As far as I know.
Yeah. When was your last tetanus shot?
Last year, high school.
So you would have been about 18. You're
Right.
42 now. Just so you know, tetanus shots are actually supposed to be boosted every 10 years.
Oh,
So
okay.
you're long
I didn't know
overdue
that.
for a tetanus shot. Yeah.
Okay.
So before you go today, we can actually arrange to have that done.
Yeah, I can do
Yeah.
that.
What about the flu shot? Do you get the flu shot?
No, I don't, and I won't.
No. As is your right, but just so you know, if you're dealing with a lot of vulnerable populations, children, the elderly, it's good to get the flu shot.
Okay.
Yeah, just to protect yourself and to protect them as well. Um, okay, when was your last physical?
Um, Been a while,
Yeah.
years. I don't know, to be honest. It's been a long time.
Yeah. You should get a physical every 2 years at least.
Okay.
Yeah.
All right.
Um, are you allergic to any foods, medications, any environmental allergies?
Not a single allergy.
No? Oh, that's great. You're lucky.
I am.
Other than the Tylenol and Advil that you take for your foot, are you on any other medications?
No.
No. That's great. Uh, your grandparents, your parents, are they alive?
My grandmother's alive.
Yeah.
She's 88. My mom's mom. Good cook.
Mhm.
My dad, or I'm sorry, my grandfather, her husband, he actually died of complications of diabetes a few years ago.
Okay.
Um, my dad's parents, they died in a car accident.
Okay.
And I have an uncle who also has diabetes,
Hmm.
and my mom has some hypertension. But other than that, we're good.
Any history of heart disease, high blood pressure, or stroke in your family?
No,
No.
a little high blood pressure with my mom, but that's it.
That's it.
Yeah.
Okay. What about your overall health? Have you had any sudden changes in weight? Do you experience any fatigue or sweating?
Well, I've gained about 30 pounds in about a year or so.
Yeah.
I sit more, so I'm eating more.
Okay. Any history of skin diseases or such as eczema, psoriasis?
No, skin's a little dry, but no.
No. It's the season for it.
Yeah.
Have you had any head injuries or do you experience any dizziness or severe headaches?
No,
No.
no,
Any issues with your eyes, such as pain, redness, watery eyes, blurred vision, or blind spots?
no,
No.
no.
Do you see the eye doctor regularly?
About a year, about every
Okay,
year.
that's good.
Yeah.
Any history of ear infections or vertigo, tinnitus, or hearing loss?
No,
Nothing.
no,
Okay. Do you have any nasal or sinus infections or issues such as frequent colds or sinus pain?
no,
No.
no, not
Just
really.
the typical seasonal cold.
Yeah, I get a
Yeah.
cold every once in a while, sure, but
Yeah.
no, no recurring issue.
Do you get any sore throats or do you have any issues with bleeding gums or mouth sores? Do you see your dentist regularly?
Every 6 months.
Perfect. Any pain or tenderness in your neck?
No, haven't had any.
No. What about the underarms? Have you noticed any tenderness, lumps, swelling, or any rashes?
No,
No. Have you had any lung diseases in the past, such as asthma, bronchitis, pneumonia, or do you experience any shortness of breath?
no, I've never had any of those.
What about chest pain?
No,
No. High blood pressure?
I haven't had a check, but I don't think so.
No. Okay. Any coldness or numbness, tingling, swelling in the legs, discoloration of the hands or the feet?
My toes are tingling a little bit,
On one or both feet?
both feet.
Both feet. Okay. And this is before or after the cut?
Before.
Before the cut. Okay. How's your appetite? You said you're hungry more. Do you experience any more? Sorry, do you experience any heartburn or indigestion? And other than the appendicitis, do you have any other abdominal issues?
No, I'm always hungry these days.
No.
I eat a lot.
Yeah. What about your bowel movements? Are they pretty regular? Any changes in that?
Um, yeah, yeah, peeing a lot, but other than that, no real bowel movement issues. No.
Okay. Are you having any trouble peeing? Are you getting up at night to pee? Or are you peeing a lot? Is your you?
I was getting up at night to pee, but now I cut back fluids, and now it's only once or twice a night.
What about your urine? Is it cloudy or clear? Does it have an odor to it at
Oh, it's
all?
clear.
Yeah.
It tastes a little sweet, but I mean, I guess what happens when you eat chocolate, right?
So I'm actually going to move on to some more personal questions. Is that okay
Okay.
with you? All right.
Yeah, that's fine.
Any issues with the penis or testicles, such as unusual discharge, sores, lumps, lesions?
No,
No. Do you do a regular self-examination?
I do.
That's good. That's good.
Once a month.
Um, you said you're married.
I am.
Are you and your wife okay with your sexual relationship?
Yes.
No. Any issues with erection, ejaculation? Do you guys use
No. No,
contraceptives?
she had hysterectomy.
Yeah. And you're aware of your wife's sexual history, yeah?
Yeah, yeah.
Okay, that's good.
It's not too bad.
Okay, so we're done with that. Do you experience any pain or stiffness or swelling in your joints or any problems with coordination?
No,
No, any arthritis or gout?
no,
No. How often do you exercise?
I do not exercise.
It's important to get physical activity, at least 1 hour a couple times a week, especially because you said you sit more at work
Yeah,
and you're diagnosed with prediabetes,
sure,
right? Yeah.
sure.
Um, have you had any seizures, strokes, or have you ever fainted, blacked out, any weakness, paralysis
No.
in any of your limbs? You said you had the tingling in your feet.
Yeah, just the
Yeah,
tingling in the
okay.
feet. Yeah.
Have you ever been diagnosed with a mental illness?
No.
Okay, when you get a cut, does it normally bleed excessively? Do you find yourself bruising easily?
Um, no, not really.
No.
Not really.
Have you ever had a blood transfusion?
I have never.
Okay. Any history of diabetes or diabetic symptoms, such as excessive peeing, thirst, or hunger?
I have all of those.
Yeah.
Yeah.
Okay. What about thyroid diseases? Any intolerance to hot and cold, changes in your skin, moisture, texture, pigmentation,
No,
any changes in your hair growth or hair pattern?
no,
No?
just balding.
Okay. Now, about you, what's your level of education, financial status?
I went to University of Illinois,
Mm.
and financially we're good.
Okay. Financially, you mean? Do you practice any religions?
No, I'm an atheist.
Can you tell me how many hours of uninterrupted sleep you get, and do you have any issues falling asleep or staying asleep?
I don't have any issues there. I've been getting up a couple times a night though, so
To
maybe
pee, you
2 or 3
said.
hours uninterrupted. Yeah.
Yeah, okay. Can you tell me what you've had to eat or drink in the last 24 hours or so?
Um, well, I had chimichanga for dinner, and I had some spaghetti and meatballs that my grandma made for lunch. And breakfast this morning was a couple pancakes and
Hmm.
some syrup.
Is that a typical kind of meal plan for your day?
Yeah,
Yeah.
it's pretty typical.
Okay. And how much caffeine do you have a day? That includes Coke, tea, and coffee.
I have coffee in the morning, about a glass, and then well, a cup, and I have a Coke about 2 o'clock.
Okay. Um, Between yourself and your family and your coworkers, you guys get along. You have some good relationships, good social support.
Oh yeah,
Yeah.
I'm really happy there.
Mm. And you said you were an atheist.
Yes,
Does that influence your health decisions at all?
just science.
Just science. You're right. Okay. Have there been any changes in your stress? Any changes in stress in your life in the last year? And how are you dealing with this new stress,
No,
if there is any?
nah,
No.
I'm pretty easy going.
Lucky you. Lucky guy. Do you smoke at all?
Cigars,
How often do you smoke cigars?
once every couple months.
Okay. And how much do you have at a time? Just one?
Just one, just one.
Okay. How often do you drink alcohol? And when you do drink, how much do you drink?
I usually I usually don't drink during the week, but during the weekend I'll have about a 6 pack, usually ciders.
About a pint.
Yeah,
Yeah.
it's about a 6 pack of pint ciders, something
So
like that.
6 pints. Okay.
Yeah.
Have you ever had any recreational drugs such as marijuana, cocaine, ecstasy?
I smoked pot in college, but I haven't done that in years.
And that would have been like 20 years ago?
No, more than.
20 years ago,
Yeah.
okay. And where you live, is there anything that you know of that can affect your health, environmental noise, or any pollutants?
Nah, it's really quiet where I live.
Oh, that's good. And how are things at home with your wife and your relationship? Everything at home is safe and nothing there can affect your health?
No complaints on my end.
Yeah. And your work, is there a lot of environmental noise there? Do you have any health hazards additionally?
Mostly in the office, no, but if I go on a site, it gets a little noisy, but I wear earplugs and
You
a
wear
hard hat,
earplugs.
stuff
Okay,
like
good.
that.
It's
So,
good to have hearing protection.
absolutely.
Okay, so that concludes my questions. Just to let you know, I think your foot, because it's an open wound, you're at an increased risk for infection. So I'm actually gonna go over wound care procedures for you, how to keep it clean, and how to keep it from forming forming an infection. I'm also going to refer you to a dietitian to kind of go over your meal plan. It seems like you're eating a lot of sugar and a lot of carbs during
Okay.
your day. Dietitian can help you come up with a meal plan that fits your lifestyle.
Okay.
And lastly, I'm actually going to refer you to have some blood work done to see if there's any underlying reason as to why your cut isn't healing. And if anything comes of that, then we'll come and we'll let you know.
Sounds good.
Otherwise, we'll arrange to have your tetanus shot before you go, and then that's it.
All right,
All
I
right.
appreciate
Yeah,
it. Thank
thank
you.
you for coming in today.
Thank you.
All
Nice to
right.
meet you.
I'll see you next time.
Take care.